So if you were trying to create just a pilot guide, what would you do differently here?
Yeah, good question. So pilot guide, on the very top, there's actually a Blue Sky Bio pilot kit. So you can actually choose the pilot kit. And if I do that, I'm not going to change it really quick, but what it's going to do is it's going to make it narrow. Now, I will say that if you're doing a pilot guide, there's no pilot guide that has a smooth metal cylinder that you can go sleeveless, because a pilot guide is going to take a cutting drill, it's going to run through there. We can't run cutting drills through plastic, otherwise it's going to shave the guide. So you have to buy pilot drill metal sleeves from your manufacturer like Blue Sky, and slide those in, and then you can do pilot guides. So you can customize the diameter and the offset, but you have to have a metal sleeve for pilot drills. That makes sense to everybody? You can't do that without. Okay.
Once you've learned all this, Matt, have you seen any need for a pilot guide?
No.
Personally?
No.
It's just in if it was just like a upper lateral or something, and there wasn't enough space for
I see. For the guide too.
For the
then you might have to.
Yes, actually, no.
That makes sense.
Yeah, totally. Because sometimes, lower incisor, right? Lower incisor, sometimes you don't have 5 millimeters to fit all that. So yes, sometimes you have to go pilot, and you're putting in like a 3.0 implant.
So there's not a different kit. It's just like you're selecting the pilot kit just for the default settings, but you're using like just your pilot drill.
So if you're in the Blue Sky world, they have a recommended pilot drill, which is just a standard drill. It's like 2 millimeters, and then the associated pilot sleeve. So you go on their website, and they've clarified that. Yeah, metal sleeve just for that, and that's all calibrated. And if you chose that in the drill kit, it'll show you the part numbers to make sure that you're ordering the right when you do the report and stuff.
The sleeve with the guide?
How do you do it? How do you secure it? So, yeah, that's a good question. So, in a perfect world, it's friction fit. It's just pressed in there. But then you think about, again, it's that calibration of like, if the resin is too tight, you can't get the metal sleeve in, you got to go and ream it out, which is annoying, right? If you make it too loose, the metal sleeve's kind of floating around in there. So, again, do a couple prints with a little bit bigger, calibrate. Or some guys use a little super glue, like leave it a little loose, little super glue, slide it in, or a little uncured resin, the surgical guide resin, put it in, and then cure the whole thing together. So in a perfect world, you just press it in and it's friction fit.